Hello friends, we're going to talk uterine ablations. I just saw my OB-GYN. We had a good 30-minute discussion about this, but they basically go in and they burn off that layer of the endometrium. So for several women, especially women that are having really heavy periods, that can be helpful to reduce the cycle. The cycle may go away altogether. It can also help with uterine cramps and pain. It's least invasive because they go in, they basically dilate the cervix, go in, burn off that layer, and they put you out for it, which is good, but it's an outpatient procedure. You can go home. It's very safe. The only big complication and risk is that you actually perforate the uterus, which my OB-GYN said is he has not seen that happen, which is good, right? You want to work with somebody that you trust that's been doing this for a long time. And you can actually go back to work. He said usually people do it like on a Friday and go back to work on Monday. So that's great to hear. There can be some cramping involved afterwards, some light bleeding. And he said about 1 in 100 cases, they do go back to the hospital to manage pain afterwards. But most people do really well. Apparently, you can only get one ablation in your lifetime. Some people, I guess, will go back and get a second ablation done, but it's not really recommended once you do that. So you kind of get one shot to see how your body responds. And again, everybody's different. He said some people significantly reduces their pain, their periods become lighter or go away altogether. He said also usually women in their 40s, like if they're 48, 49, their period may just go completely away and they don't have to worry about it anymore. The pros, it doesn't involve hormones at all. It's not going to affect my hormones in any way. I can't do birth control or like synthetic estrogen or anything with my history of a sarcoma. So it's kind of nice that this is something that could help me without that. And I think if it's very least invasive, right, they're not cutting anything, it's not like surgery, that is a pro in my mind for sure. The other thing that he told me is once you have an ablation of the uterus, it is less likely that you can get pregnant. Now that can still happen in some cases, but Mark has had a vasectomy, and because of my sarcoma history, my oncologist, it's recommended for medical reasons that I do not get pregnant. So this is kind of in a weird way good for me to know, and we can do that, and it's one less thing to worry about with that as far as like the health risks and complications that may come through that. So lots of good information, kind of sitting with it. They said they would give me some medicine the night before that's going to again help to dilate that cervix. And then you go in, they put you out under general anesthesia, and the whole procedure takes 90 seconds. And then you're done. So send me all the good vibes and juju. I'll take you guys along this journey with me. I'm waiting for them to schedule it, but we have met our deductible, our out-of-pocket max, and you know, your body will tell you when it's time to do something else, and the dietary changes have made a huge difference in my life. The essential oils, adding in the lifestyle changes, and I feel like it's time for this next step to try something. And I love all of you that have reached out and shared your experiences with me. And if you have something that you want to share, please share too, because I'm open to learning. I think there's power in this community and sharing what we learn. Have a great day. I'll keep you posted on this journey. Take care. Bye.